I have two questions for you, and both matter right now. First question is, do you know who Roger Severino is? Second question is, if someone asked you to describe reproductive care, could you, in one clear sentence, or maybe even two sentences, accurately describe what it is? Keep watching and I'll answer both of these questions, and I'll give you sharp, usable information about Project 2025 and show you what this means for people's healthcare, our healthcare, and what you can do next. And I would say share this with someone who thinks that it's only about abortion. Now, keep in mind that people who are not interested in facts and are going to argue their side regardless of what you say, those are not going to be the people that you're going to be able to show the information to. First, you're not going to be able to persuade them or dissuade them from their position, right? So basically, what we're going to talk about here is we're going to get into the receipts using the Project 2025 manual. There's also a task force, Stop Project 2025, that was done by, I think, the likes of Representative Zoe Lofgren. And basically what that does is it condenses that 900 plus page manual into about 132 pages. And it pulls out with each chapter the important things that you need to know. That way, if that whole 900 page document seems overwhelming, you wouldn't have to go through it. You can just look at, that task force. Also, we're going to talk about the Comstock Act, the Hyde Amendment, and basically use, just plain information about what these laws and what this plans, what it means for us. And again, if it feels overwhelming to you to try to get into it, then I would say start with the task force manual and then go from there. Either way, you got to get informed and stay informed about what Project 2025 is planning to do, what these architects of Project 2025, these Christian nationalists, are planning to do, not just around our healthcare, but around how they're planning to govern. And so I would start off by saying, when you hear the Department of Health and Human Services, or DHHS, you probably think, like most people would, hospitals, maybe TANF. And if you don't know what TANF is, that's temporary assistance for needy families. You may hear someone talk about SNAP or Supplemental Nutrition Assistance Program. You may think about maybe, say, CDC, NIH, vaccines, Medicare, maybe Medicaid. Just the basic services that people expect. What people don't picture is a political play to remake that department into this so-called Department of Life and Family. And right now, these Christian nationalists and other Project 2025 architects are deciding and have decided what counts as real health care, which families deserve protections, who keeps coverage, who loses access, and who becomes disposable. So all of this is covered in Chapter 14 of the Project 2025 manual. And it drills into what they're going to do. And this chapter runs roughly about 20 pages or so. Well, I say 20 pages because some of it is just mainly as you get to the end, it's like just acknowledgments and stuff, references. So, but basically it starts on page 482 and about 502. And the public draft has been associated with Roger Severino, and he's their little policy person. He's a civil rights attorney that has worked in the first Trump administration, and he's also a figurehead over at the Heritage. But either way, the person that's implementing his part of the SOP is Robert F. Kennedy Jr. And that's why it's important that you read and you follow these policies so that you can judge for yourself to see how these people are laying out their agenda and how they are reshaping how the government distributes our funds, how they reinforce laws, how they're using the laws like Comstock, and how they are defining government health care. And I need you to hear me, right? I really need you to hear me when I say this. First and foremost, reproductive care is not only about abortion. That's what a lot of people want you to focus on, but that's not what it is. It's a full set of medical services that protects people before, during, and after pregnancy. Second, the real experts in this are the clinicians, right? That's the OB docs, the OBGYNs, the midwives, the reproductive endocrinologists, the family medicine doctors, your nurse practitioner that's board certified in women's health, not politicians or some operative or some religious zealot who's trying to tell you what is or is not science. So it's the combined expertise of these subject matter experts, their knowledge, their hands-on lived experiences that they focus on day in and day out, they've been school trained on, that should provide what our care looks like, what quality care looks like. And they're the ones that should be leading the policy. They're the ones that, if you need any more additional information, if you need care, this is who you check in with. That trusted provider or that trusted clinic, not some spiritual advisor. You can do that for your spiritual needs, but for health, I strongly would recommend that you go to people who are school trained, have seen these things day in and day out, because this is what they dedicate their life to do. All right. So, but what you got to understand is when reproductive care is cut, you know who gets hit first, right? Your rural, your disabled, your veterans, your low income, your minority communities. Our communities are the ones that suffer the most. And studies have been published by the likes of Gender Equity and women's studies have shown that maternity deaths has climbed where abortion access has been restricted or cut altogether. And I need you to bookmark this stat and share this graphic, because people need to understand this. This is not just about abortion. Abortion access or lack of abortion access is going to and has already exacerbated already severe racial inequities in medical mortality, right? And that's not just me saying it. That's according to women's health studies that's been published. And Project 2025 is not pro-life. And it's not just an anti-abortion push. It's a master switch that is shutting down whole maternity floors and services. And when the chain of care or any of that reproductive care is delayed, or if it's broken, people get sick and more people die. And that's what we're seeing. And oddly enough, it's so many people walking around disengaged and not knowing that this is happening, or even worse, they voted for people and policies so that this exact thing could happen. And this disconnect is deadly. And this is not abstract. I'm not saying this just to be facetious or trying to get you to think that I'm an alarmist, but these are the things that are happening right now. And these policy fights, these policy decisions, they're playing out right now on state and federal levels. And Project 2025 it represents this map, this blueprint for these Christian nationalists that's reshaping how our healthcare system works. And so that's why it's important that we pay attention, that we know who is being hurt and why it's important that we say something. And reproductive care, like I said, it's not just one thing. It's every medical service that protects people's health and choices around pregnancy. And that includes trying to get pregnant, that includes trying to be pregnant, that includes being pregnant, a baby safely, or healing after the pregnancy happens. So it's a full circle of care that follows a person before, during, and after pregnancy. So that's pretty much what it is. And the significant parts of reproductive care we'll start with prenatal care. So prenatal care is a care that is received during the pregnancy. Right, so it's the medical visits, it's the blood tests, it's the ultrasounds, it's the guidance or recommendations that you would get from your trusted healthcare provider to keep you and your baby safe and healthy during the term of your pregnancy. And then there is the postpartum care. And postpartum care is a care after baby is born. And this includes everything from the healing checks, your mental health, your overall recovery. And this is not to be confused with your well baby exams and well baby care. That's two separate things, because now you're dealing with two separate people. And then there's things like emergency care. And this means the immediate medical attention for any life-threatening problems that can arise during the pregnancy or after the birth. So that could be anything like heavy bleeding, dangerously high blood pressure, meaning preeclampsia, eclampsia, any infections, or any type of trauma or anything that would arise that would cause hurt and harm to the mother or the pregnant person. And without this immediate emergency care, then guess what? People can be severely harmed or even die, which we've already seen. And then there's things like miscarriage care. Miscarriage care occurs when the pregnancy spontaneously ends on its own. And doctors may use medication. Often it could be mifepristone followed by misoprostol. And I've taken both of these. It could be anything like some people you may hear it called a DNC or a dilation and curettage. I've had that done before. So basically what these procedures do, or this medication does, it keeps you safe. So that should you want to continue with trying to get pregnant or whatever the case may be, that choice is there. This is routine care, full stop. And again, I've benefited from it. So I'm not telling you something that I've read about. I'm not telling you something that is just a statistic. I'm telling you something from experience. And I'm thankful that I was able to get this care and not have to worry about whether or not I had to go somewhere else to get it. And then there is ectopic pregnancy. Ectopic pregnancy is a medical emergency, right? That's when a pregnancy implants outside of the uterus. Usually it's in the fallopian tubes, but either way, it's not where it should be. The pregnancy is no longer safe. It cannot continue. And listen, I don't care what these folks are saying, it cannot be re-implanted. That's just crazy, right? It must be treated right away to prevent any life-threatening harm. So don't let somebody tell you otherwise. And then there is abortion and medication abortion. This, again, is medical care, full stop. Abortion is when a pregnancy is ended on purpose, regardless of why it's ended. And that keeps people safe and it preserves their choice. And abortions can be done with pills. It can be done as a surgical procedure in a clinic or a hospital. Whatever the case may be, the care is safe and is well regulated. The medication is approved by FDA and it's used around the world. So regardless of what people are trying to tell you, this is just, it just gets to where we're beyond silly season and people are starting to use junk science. And then there's these things called artificial reproductive technology, or you may hear it referred to as ART. And that is care for people who need help getting pregnant because the natural route just by themselves is difficult. And so that includes things like IVF. IVF is when the eggs and sperm is combined in a lab and then that embryo is placed into the uterus. I went through 2 cycles of IVF. Then there is something called IUI, that is intrauterine insemination. That's where the sperm is placed directly into the uterus during ovulation. I went through 6 cycles of this. And it's not just these easy things. There's a lot of things, prep work to get you to that point. But just so you know, this is what ART looks like. And there's other things that fall under that fertility treatment, various medical support that you get for this. And then there is birth control. Birth control pills can be anything from the pills, the IUD, to the shot. And it also includes Plan B. Birth control basically helps people avoid being pregnant when they're not ready. Or it could be used for health reasons. So I've used birth control for not to get pregnant, and I've also used it for health reasons. Health reasons such as if you suffer from fibroids or polycystic ovarian syndrome, or if you have endometriosis or you have heavy cramping or heavy bleeding. People use the pills for different reasons. And it's not just because they don't want to get pregnant. And again, it can be a shot, it can be the IUD. The emergency birth control, what you hear referred to as Plan B or something like that, is used when your regular contraceptive either failed or you didn't use it. What that does is it delays your ovulation, aka your fertility window. It is not an abortifacient. So regardless of what people are trying to tell you, Plan B does not kill a baby. It does not kill an embryo or whatever you want to call it. And again, any break or delay in this care cycle for reproductive care can lead to substantial harm. And so you're not just getting inconvenience. You're getting people to the point where they are physically and mentally harmed. And understand this, Project 2025 isn't just coming for abortion. They're coming for that whole chain of reproductive services. And as we get deeper into chapter 14, you're going to see that. You're going to see what they're doing and their thinking behind how to, in their way, tell you how to have a child or not have a child. And you're going to see who they would prefer to be the gold standard, that nuclear family. And so whether it's reproductive services, whether it's contraceptive, whether it's art, whatever it is, they're coming for it. It could even be something that would include the cancer treatments. If it's linked to reproductive care, guaranteed they're coming for it. And if they are able to have their way, pregnant people, our whole care surrounding that is going to collapse. And then if you think about post-Dobbs reality, the post-Dobbs reality, what's happening already, the studies that's been published, and let alone the studies that are not, the deaths that are not being reported, the mortality of the maternal deaths that are not being reported, especially in states that have the bans or heavy restrictions on abortions. And you already know, if you don't know, there is a severe, I'm going to say lopsided healthcare inequities in racial care. So Black mothers face 2 to 3 times higher mortality than, say, your white counterparts, especially in those states that have these access risks or have severely hindered their access. So this harm is real and it's measurable, and we're seeing it in real time. And then you're starting to see more maternity care deserts. We're starting to see more maternity care deserts in southern and rural locations where hospitals are closing entire delivery wings and services, especially in those southern areas that are hardest hit by these restrictive accesses. So that means in real time that patients are having to drive, or they're giving birth in unsafe places just because of their commute times. And so there are reports that, people are being, they're having to pull to the side of the road, or they're having, they're giving birth in unsafe places, or they're doing it by themselves. And this ties back to Project 2025. Project 2025, the proposed policies that would make abortion access harder nationwide. And they're leaning on these old laws like the Comstock Act. And among the levers that they're using that deals with the Comstock Act straight goes to abortion pills, because that is the most common form, the safest form of medication abortion. And so any supplies, anything that deals with the information, they're coming for that. And so that what they're doing is they're trying to reinterpret these protections tied to emergency care. And so they're trying to come after EMTALA. And if you don't know what EMTALA is basically an act that says a hospital has to give you treatment regardless of whether or not you can pay for it. But that treatment has to be life sustaining. And if they can't, they have to transfer you where you can get that care. And so they're trying to dampen that to where if you are having to get some type of reproductive care service, specifically abortion care, that they're making it so cumbersome that people are not getting it. And this is happening regardless of what state you're living in. So if you live in a state that allows for reproductive care or access to abortion up to a certain time period, that if they have their way, that's not going to be the case anymore. And so that's what they're trying to do. And they're trying to double down on the funding, such as the Hyde Amendment, or you can see like the latest victim being the VA, where they have totally taken away abortion services and counseling. So this is what they're trying to do. And they're trying to reduce the services. They're trying to cut the funding. They're trying to shrink our protection. And so this is why this matters. And less abortion access means delayed care, impossible care. It means more emergencies. That means more miscarriages. That means unsafer pregnancies. And listen, just because you restrict abortion, it doesn't mean abortions are going to stop. It just means that safer abortions are going to stop. So that's why it's important that we deal with this. And when they cut care, whether it's Medicaid or something like that, they're straining hospitals, they're straining providers, and they're pushing more of the counties into these maternity care deserts. And so these restrictions are making it so where people are having to commute longer, or they're taking more risks just to be able to continue or discontinue a pregnancy. And so that's why it's important that we get the information out and people start to be informed, stay informed, and go to your local and your state policymakers, because that's where these test labs are first happening. They're not happening at the federal level. The beta testing is happening at your state level. So that's why you have to get informed and stay informed and be active, because any type of reproductive management is already under threat, and it's becoming more and more dangerous. And this is not a theory, it's already happening. There's data to support it. And so until we get busy and do what we need to do to get these Christian nationalists out of our healthcare, out of our medication rooms, out of our patient care rooms with the patient, their family, and their doctors, until we do that, then this isn't going to happen. They're going to keep on pushing their way and pushing until they find a weakness and can have their way. And so things that we need to do is we need to advocate on our state and local levels, so that way federally they won't have an access foothold. And we need to do so that it's not too late. And we need to advocate, push, pull, scream, whatever, so that they can restore the VA funding and access. And if you don't know who is overseeing the VA, that's white evangelical pastor Doug Collins. And so it's not hard to see how they're using their religious beliefs to come after our healthcare and other things. This is just one chapter of harm. And so I would encourage you to share this information, to read the manuals, to understand what's happening and what's being proposed, what is already changing. All right. The next chapter, I'm going to say the next video, is going to be a deeper dive into chapter 14, where we're talking about specifically what the Comstock Act is, who and how it came about, the Hyde amendments, and going deeper into how these Christian nationalists are planning to use their tools and access to hamper our services. All right, until then, I'll see you on the high road. Keep watching, like, and then share this information.